This video is to demonstrate how to properly draw up either a medication or a vaccine from a vial. And this is specific to intramuscular injections into the deltoid. So first you're going to take your vial. The ones we use in clinic for the most part are single use. In this demonstration I have a multi-use vial for training purposes, but we're going to pretend that it's single use. And the first thing you're going to do is make sure that it is not expired. Then you're going to flip off the top, and just to make sure it is clean and sterile, you're going to clean it with an alcohol swab, focusing on the center rubber section for 10 seconds. And then letting it dry for 30 seconds. While that's drying, you can get your syringes and needles ready. To draw up the vaccine or medication, you're going to use a 5/8 inch 25 gauge needle. Gauge is referring to the diameter around the needle, and the 5/8 inches is how long the needle is. So you're going to open your packaging in a sterile fashion using the techniques demonstrated in the previous video. You're going to take your syringe, screw it into the 5/8 inch needle, pull back the safety, and now you're ready to draw up from the vial. You're going to remove the cap. You're taking your vial, and then you're going to draw back the same amount of air as you are going to be removing fluid from the vial, and that's to equalize the pressure within the vial. So if you're taking out 0.5 milliliters of fluid, you're going to draw back and inject 0.5 milliliters of air first. This also technically reduces the amount of bubbles you will get. So I will place the needle through the rubber of the vial, push in the air, and then I'm going to take the vial and turn it upside down, making sure that the needle is within the fluid. If the needle is above the fluid line, all you are going to get is air into your syringe. Then I'm going to pull back the plunger and fill the syringe to the 0.5 milliliter mark. In most cases, this will be emptying the vial of vaccine or medication. You are then going to place the vial back down on the counter and remove the needle straight up. And then you're going to pull back even further to remove the liquid that is remaining in the needle, because we are going to switch our needles. You then cap your needle using the safety, always against the counter, never use your hand. And then you're going to twist off the needle and place it in the sharps container. And now you're going to take the needle that will actually be doing the injection. In this case, we're teaching on intramuscular deltoid injection, so you will be using a 1 inch 25 gauge needle. You open this needle similarly to the other packaging in a sterile fashion, and you twist on the syringe like so. You then need to prime the needle to make sure there's no air going into the muscle. And you do this first by flicking any air bubbles to the top of the syringe. Air is lighter than liquid, so it'll fly up to the surface. And then you prime your needle by watching little fluid bubbles come out the top. And now you're ready to give your injection.